Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
All right, so we are live at our NCPDP Annual Conference 2026, and I'm so excited to be here with Julia Vu, who is our new Executive Vice President of Public Policy and Professional Affairs. So Julia, welcome.
Thank you for having me.
Yeah, super excited to talk to you. So you have been part of the NCPDP community for a while now. Now you're on staff. It's been what, 3 months, 4 months, or not even?
6 weeks.
6 weeks. Okay, so I just want to get your initial impressions before we dive into more questions.
Yeah, that's a great experience, a great question. Always had a great experience as a member, and now that I'm fully on board with the executive team, I'm very excited of what we can do at scale with fellow industry leaders, with cross-collaboration in the industry. Very excited to do this at scale.
Yeah, fantastic. All right, so before joining NCPDP, you were with Elsevier, and you were also with Cerner. So you've got some great kind of background for this role. Can you talk a little bit about those roles that you had and what you did there?
Sure, I'll start with Elsevier. I had a wonderful time at Elsevier working on our AI clinical decision support. So how that has helped is it allows me to join the conversation with folks in the room here today, like Anu's wonderful session with standards and AI and prior auth, as well as my focus on our physician advisory council that we did at Elsevier. I had the pleasure of leading that, and that really feeds into the roundtable that we lead together here at NCPDP with CMS. So that's the Elsevier side.
Yeah.
With the Cerner side, I spent most of my life in interoperability with the EHR. And I do have to give a special shout out to you and Trisha Lee, because exactly 2 years ago at Annual, you both were on a fireside chat and you had said, with EHR interoperability, meaningful use, all the work was done in the health system, but we were left behind. So 2 years later, it's really excited to bring that acumen and those best practice experiences of what worked or what didn't work, and to really collaborate with other EHR vendors and other solutions that hook into the EHR and pharmacy management systems today.
Yeah, I love that. That was actually a fun conversation we had. And I remember you coming up afterwards, so that's great. And I love that your background is more than just pharmacy. Obviously, you're a pharmacist, but having that kind of extra, figuring out with the providers and working with the EHRs, because everything we're talking about these days is really about how do we make sure that pharmacists are part of the care team, getting the data, all of that. So having that background is amazing. That's wonderful.
Thank you so much for emphasizing that, because I know you and I talk about this often, that we are really moved with our mission to support the expanded scope of practice for pharmacists. That said, with the Rural Health Transformation Program, about 7 or 9 states support that. However, do they have access to interoperable data? So really excited to fight that fight with the members with you today.
Yeah, excellent. So I want to switch topics a little bit. So NCPDP is a friend of the network for the CMS Health Tech Ecosystem. They recently had an event, a live event in DC that you attended. Can you tell us a little bit about that event?
Absolutely. I had the pleasure of representing NCPDP at the CMS Health Tech Ecosystem. It was the first wave launch, and it really was the first wave of what's to come next. So at the event, I think everyone on LinkedIn, if you felt that you saw a lot of partnership announcements on April 9th, you did. And that was a representation of how broad and fast this ecosystem is moving. So instead of just 1 or 2 partnerships, there's multiple components that create a health tech ecosystem, like patient identity matching, TEFCA, CMS aligned networks, similar to our PAI identifier that we have here in our SureLink that we announced to the members today. So if the first wave was very focused on patient identity matching, health network information exchange, there was still an unknown on what to do with that PDF data. There wasn't information on structured data. So I'm really excited to be sitting with you here today, because it feels like the second wave has already started. Because if you are also paying attention to LinkedIn and CMS today, there was an announcement today about that next chapter of the health tech ecosystem, bringing prior auth in and including NCPDP standards for drug prior auth modernization.
Yeah, I did that literally, I think just came out about
Just
an
dropped
hour
today.
ago, which is fantastic. So, the way it sounds like it's working is it's really a private public partnership, right? And CMS is really looking to industry to lead this effort. And so, thrilled to see the prior authorization use case get announced today. There was a proposed rule that came out that also named NCPDP and fire standards, and I know they're waiting for those comments, but I think we could really support the use case that CMS has put under that. I know you and I and some of the members have been talking about some interesting new kind of ways that we can support prior auth, including maybe a new AI standard for bots to kind of talk to each other. Can you tell us a little bit about that? I know it's not fully baked, but kind of in ideation right now, right?
Exactly. So, Pooja, you know me well. I am big on ideation, and one of our board members recently returned back from Chai talking about agents talking to agents. So, in terms of the prior auth workflow, you could sometimes have a situation where a physician AI bot is talking to a prior auth bot. So, that's something that here in the halls of this conference here, what if you could have a standard in between or leverage the standards that we have here at NCPDP already to support that? And then going back to the CMS Health Tech Ecosystem, we had seen a lot of collaboration with folks with wellness. So if you have an Aura Ring or a Noom app, perhaps that could be fully integrated with AI, with our NCPDP standards, so that the pharmacist has that full view of you're taking 5,000 steps a day, you're taking your blood pressure medication, and this is what's happening to your blood pressure. So long-winded, but as Pooja said, we are ideating, but again, terms of information that agents to agents are talking to each other or AI is picking up and sending out, there's another next leg of the race, and the NCPDP standards really does connect those AI agents together.
That's great. So I want to stick on the topic of AI for a little bit longer because I know at Elsevier you did quite a bit of work around AI. Just get your thoughts on what else we could be thinking about, whether it's at NCPDP or within pharmacy around AI.
Yeah, that's a great point. And going back to your first question, what really excites me about being at a standards development organization that's within the mix of health IT and pharmacy, we're also working with CHI in terms of different cross-collaboration between our organizations. So going back to Pooja's ideation example that we had in the hallways this week, if NCPDP drives the drug standard, then our partners at CHI can drive the model card and testing evaluation. So that's something what I'm excited about. And going back to Pooja's question, at Elsevier, our health systems, our pharmacists, and our payer partners with AI, they really emphasized us to say, well, everyone has a responsible AI principle. Every vendor has one. But it would mean something if it was harmonized to external standards like CHI and NCPDP.
Yeah, that's great. All right, so I know you were brought on to replace Steve Mullinex, who was with the organization, I think it's 17 years in this professional affairs role and working with our partner associations. So what are you looking forward to most around that? And maybe just some thoughts on kind of how you're going to make that role your own.
What an amazing legacy. Steve and I often talk about how pharmacy and PBM, payers, health system, how the industry was 15 years ago and what we've done since then. So with his role, and he's really brought people together, I'm excited to carry the torch for him, continue our wonderful relations with our pharmacy professional affairs and our government affairs folks. But with that, we are also really excited to dive deeper into my network with other health IT leaders out there and also with physicians out there. And last but not least, I love coming to and from the Scottsdale office, but being based on the East Coast, I'm really excited to have more touch points with our organizations in DC, with our pharmacy organizations and our government associations that we have great relationships with today.
Yeah, that's great. And I know there's an upcoming advocacy tour that it'll be, I think, your first one.
Yes.
Talk a little bit about the priorities that we're going to be talking about on that advocacy tour.
Great. We've hit a lot of those priorities on this podcast today, where we're also taking information from our members today. So the pulse of the room, where we'll be talking about prior auth. we'll certainly be talking about cash pay and how that can fit against a deductible, but also from the patient experience, what's your better option of the cash pay against deductible or the insurance price against a deductible, and how can they talk to each other in real-time prescription benefit with our standard. So we'll focus on prior auth, we'll focus on that as well. And then also the Rural Health Transformation Program, we had talked about that before in terms of expanded scope of practice for pharmacists in 7 or 9 states, but limited EHR or health network access, or also limited pharmacist services billing in those states. So we'll attack those 3 key issues.
That's great. All right. So I know we're getting ready to wrap up. Would love to just better understand kind of how you see success. Like, how are you going to define success for this role?
Yeah, so I would answer that in 2 ways. I see our success as more of that industry cross-collaboration, as Pooja had mentioned, with my vision with you to expand our professional affairs in pharmacy, physician, health IT, and government spaces. And then the other answer, the success lies in our members. Being here all week, I'm very moved and proud to be a part of an organization where we get a lot of stuff done by work group and task group leaders like you in our over 70 task groups that we have today. And as Pooja mentioned, you guys are rolling up your sleeves and working on comment with prior auth with us. So again, industry cross collaboration and a very diverse, productive membership.
Fantastic. Well, Julia, thank you taking the time out of your schedule. I know you're busy too this whole week, meeting with the members and doing lots of things. So appreciate your time and can't wait to continue working with you.
I'm so happy to be here working with you. Thanks for having me.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.